Before we begin, we would like to acknowledge the traditional owners of the land of which we record. We pay our respects to elders, past and present, who are part of the world's oldest continuing culture and the first storytellers. We acknowledge the importance of supporting health for all peoples, now and in the future. Aboriginal and Torres Strait Islander people are warned that this podcast may contain the voices and names of people who've passed. Welcome to the Heart Kids podcast. Join us to hear stories of Australians affected by childhood heart conditions. On this podcast, you'll hear from heart kids and teens, heart adults, parents, carers and family members, cardiologists and other health professionals. My name is Rachel Knowles and I'm one of your hosts. I'm a journalist and I live with a congenital heart condition. I was born with tricuspid atresia, had Fontan surgery at the age of 2. I'm passionate about people and their stories, and I'm excited to walk with you on this journey as we share experiences and learn more about those of us living with childhood heart conditions. Today on From the Heart, we're joined by Dr Mary Tallon, a clinical nurse specialist in cardiology at Perth Children's Hospital, and someone who's played an important role in shaping how care and support are delivered to children and young people living with childhood-onset heart disease.
We don't need to use big, complicated, medicalised words in order to have a really sound understanding of our own heart health. And being able to meet that always with your heart is a young heart. It's needed support for a range of different reasons, but it's very different to having heart disease that older people have. It's a whole different ball game. So I think separating that is really important as well, because going into the adult setting can be confronting.
We'll be talking about what it means to transition to adult care, the important time when young people begin taking a more active role in their health and move from the Children's Hospital into adult services. Thank you for joining us, Mary. Where are you dialing in from?
Oh, I'm dialing in from beautiful Whadjuk country, one of the many lands of the Noongar Nation in our beautiful Western Australia. So I'm in the metropolitan area. I'm actually seated in the Perth, one of the meeting rooms in the Perth Children's Hospital, where I work at the moment.
Wonderful. Beautiful Noongar Buja, we love.
Yeah.
I suppose to begin, tell me a little bit about yourself, your background and your role at the Children's Hospital.
Okay, well, with my hand on my heart, I always say I'm a paediatric nurse. I also am a midwife and a nurse researcher. So I've been around for close to 100 years, only kidding. But I work as a clinical nurse specialist in our cardiology department at the Perth Children's Hospital. And it's really, I guess, advanced practice nursing, but just such a privilege to walk alongside families from the very beginning, as early as a fetal time, right through to whole of life. But from our perspective, we see our patients and families transition to adult care, but through Heart Kids, and we see them well into adulthood too, which is fantastic. Yeah.
Oh, that's so special. I imagine that you've had lots of babies that have grown up.
Exactly. Yeah, I was just thinking about this, that many of our beautiful young people who are coming in for transition care now, it's their mums I've had close relationships with at the time of diagnosis. So it's a big time for the whole family.
I am a big fan of obviously everything you do, I love, but particularly your work on the Australian standards of care for childhood-onset heart disease. That was a massive thing for our community. And I'm really interested in kind of what that experience was like and how having those standards now actually translates to the work that you do every day.
The standards are in my head every day, and I can't tell you what a wonderful experience it was to be involved in the development of the first Australian national standards of care for childhood-onset heart disease. I think it provides a vital and important benchmark for quality care and continuous improvement from here on in. And it's a really clear document in terms of informing healthcare providers, but healthcare planners, but very importantly, patients and families themselves, so they can know what to expect when it comes to accessing services, and it can really help them to consider what questions they need to ask. Working alongside co-chairs Professor Gary Scholler and Dr. Lisa Selby, and alongside Jessica Keating from Heart Kids, currently the operations manager, was such a joy. I felt I had to pinch myself, and also to the rich discussions with people who are expert in their field, the expert clinicians, but also the families with very rich lived experience. And I do feel, again, with my hand on my heart, that they are really nicely and beautifully embedded in the document.
I love that. I think, I feel in my own journey talking to so many heart kids, you do have doctors and people who come into this cardiac space do it because they love it. And it's really nice to have standards that we have people that have been so invested and spent their whole lives working with our community who have been able to develop this from that place of love with us. So it's really special. So when it comes to that transition into adult care, I guess quite an abstract concept in like a clinical setting. But what, I suppose, in your expertise, what does that mean specifically in the context of having childhood onset heart disease?
Yeah. So a transition to adult services is something that should be a series of many conversations. It should be a seamless sort of process. There are so many transitions in life, and transition to adult services is one of those really important milestones. So it's really about preparing young people living with childhood onset heart disease to feel empowered about being in charge of their own care as they prepare. They'll always have family members, those who love them, in their court, but going from an environment where it really is very child in the concept of family focused to communication being quite individual and responsibility being imparted onto that individual it's a big deal.
I think you answered exactly the question I was going to ask you, actually. That was perfect. But I think something that shocked me in the transition was I would sit in a chair and they would speak to my mum. And then all of a sudden I went to this hospital and they were talking to me about phrases that I wasn't super aware of, and I had to look at my mum and be like, what does that mean? Can you translate what this means to me? And I think it's a really beautiful experience, very scary, but it's also a really beautiful experience to have autonomy and agency over your health and the doctors that you have involved in that as well. I suppose young people who are looking towards that transition period, what stage should they start thinking about that? Are there some phases or a kind of process within that?
Yeah, so we really advocate that conversations around transition to adult care start really early, start many years before the transition or transfer of the transition is going to take place. So as early as 12 to 13 years of age, ideally, and that we start talking about it. So it's not going to happen for a number of years now, but it's good that we start talking about this. We talk about 3 phases of transition where we are, and I guess each of the centres might do it slightly differently. But our first phase is that of introduction. So what we do here is send a letter out to our young people and say, welcome to transition. and include in the letter a little bit about what that means. It's an exciting time. It's a time for you to think about your own health and consider the questions you want to ask at your appointments. And we'll be having some of these conversations in coming appointments, and that you can expect to receive an invitation to come to a transition clinic. So it's really important for transition that our cardiologists will see the patients for their cardiology care, but transition is a transition dedicated clinic. And it's not medicalized. It's really all about healthy talking about preparation, empowerment, how life is, what are the areas that there may be a little bit of an opportunity to provide a little bit of additional support at this time to help prepare for transition. So the introduction is like 12 to 13. We send that letter out. Sometimes it's towards 14, and we've started this process and this more formalized transition clinic service in 2023. So we're still catching up. We started with the older ones and we're working our way back. So we're down to like the 14-year-olds now, which is fantastic, to let them know that they're part of transition. And then our 15, 16 and 17-year-olds come for a planning discussion, and that's a face-to-face appointment. And they have time with our transition doctor, but first of all, they have considerable time with us, with the nurses, the transition nurses. And that's it's about a 2-hour appointment. And while there may be some cardiology stuff, some particular scans and things to plan that are all going to be really good to have done before transfer occurs, but the transition is really about continuing those conversations that have hopefully started at home about what transition is going to look like for me or for that young person.
Beautiful. When you are working with young people, what's a good transition experience, or what do you hope for them to walk away with? What's the pillars that are what you aim for?
I hope them to feel excited in some ways and reassured. Very importantly, not alone or not scared, and that we have demystified some of those big words. In particular, we would like to think that they feel really empowered about their own heart health, and maybe sometimes have a clearer understanding of the ins and outs of what occurred when they were small, and particularly if there's been surgery. And when young people use, say, tell me about your heart in your own words, they've got it so well in terms of, I needed more blood flowing this way, that way. We don't need to use big, complicated, medicalized words in order to have a really sound understanding of our own heart health. And being able to meet that always with your heart is a young heart. It's needed support for a range of different reasons, but it's very different to having heart disease that older people have, like coronary heart disease. It's a whole different ball game. So I think separating that is really important as well, because going into the adult setting can be confronting.
So when it comes to that transition into adult care, as I mentioned before, I sat in the doctor's chair, had no idea what words were being said to me. I didn't know. The language I had around my heart was there was a hole in it. I wasn't particularly familiar with medications or dates or clinical names for the surgeries that I'd had. So I think from my experience, it would have been very helpful to have that language walking into that space and to be comfortable with that kind of language. Yeah. What is your recommendation for young people coming in around the terminology around their body and the information they need to know to feel prepared for adult care?
Yeah, I think having a good understanding of their own heart condition in their own words, not in words that don't sit with them, but in their own words, so that they really clearly understand the flow this way, there may be a hole there, so that when things are mentioned, they know what's new and what's not new. I think also knowing the reason why the doctors are recommending they see a specialist in adult congenital heart disease if they have congenital heart disease is really important as well, so that they know it's a specialist clinic. And I think understanding that you may only see them every 3 years, but it's really important that you see them and not another group of doctors. I think having some knowledge and understanding around any anticipated treatments or procedures that are likely to be coming up, say, in the early 20s, so that roadmap is up there in the horizon somewhere. There may be something I have to have, a procedure or something like that in a few years' time, so that it's not such a shock. So that sort of general roadmap in own words, and a real confidence, I think, the importance of asking questions, preparing for your appointment, writing down the things, because if you ask the question, you understand things in your own words, it's going to make perfect sense to the doctor in order to be able to answer that. It's really clear you've got a good understanding. I think, language can be very confronting when you hear things you don't understand, but if you have a good understanding about your own self, I think it holds you in very good stead. So
It is about confidence. It's about advocating the speaking up. It's about drawing on for us in transition, it's about also really identifying within, as well as the heart health, within the family unit, who the main close people are, who, you have someone to go and talk to, who's going to be supporting the process. And we talk about lots of other stuff as well, which I'll go into, I'm sure, when you go through that.
Loved what you said about asking questions, because I think that's a big roadblock for young people, and there's quite a power dynamic. It can be quite scary. And I think that's been a very big thing for me, is learning that actually the more I ask questions, not only the more that I learn about my body and can advocate for myself, but I have better relationships with my healthcare providers and with my cardiologists and my specialists, because they're understanding what I want to know.
Completely. And how do we create that really safe and secure space for our young people to speak into completely freely without feeling that they're getting their words mixed up or whatever they might be in their head? We want them to feel completely welcome and safe and secure and have that confidentiality. And the other thing I said, as you may know, with transition, is we see our young people by themselves. And that can be a little bit of a big step for them too, when they're used to having their folks in the room as well.
Yeah, 100%. And look, I think I probably got a little bit too comfortable with my cardiologist. I'm sure he would want me to stop asking questions sometimes. I've got a lot.
That's a good thing.
I like to chat.
Yes.
I think a lot of this does start in the home. And you said about building that confidence for parents and carers who listen to the podcast. What are the ways that can start in the home for young people?
Yeah, I think with the introduction, the idea would be that these conversations start happening at home in preparation for transition. So how is it going to be when you go to your appointments? How are you going to get there? And things like planning to start the driving lessons, and going to have your own Medicare card, even those, starting with those practical approaches. But I think at home, the important thing is also, as well as talking about the practicalities, is identifying really what those beautiful protective factors are within the house, within the home. And you just know that there's a lot of support. And while there's a transfer of autonomy from parents to our teenagers, the parents are most likely going to be at the appointments as well. It's just that the questions are going to be to the adults. So you always have your cheer squad, and we celebrate that. Yeah.
With transition as well, as much as it is about what happens in the hospital and in those settings, it also is the next life stage, and it is preparing you for what life would look like with a condition of this nature beyond a hospital. I guess in that kind of transition process, how is that independence and that confidence manifested beyond the hospital, and how is it supported beyond the hospital?
Yeah. So I suppose it really does come from themselves. If I chat a little bit about what it is we talk about certainly it's, I suppose, more a psychosocial assessment. We often use the eHeads as an online survey, which highlights different areas that the young person might want to talk about, but that will include at home, who lives at home, do you have someone to talk to, how's school going, how are the peer support groups, how are the peer groups going, relationships, sometimes issues around experiences that are positive and maybe negative at school come up, but out of that, it's also what dreams and aspirations, what would you like to be doing after school, or if they have already left school, what are they working towards? So really having supportive encouragement that match what their dreams and aspirations are. And I'm just bowled away by how articulate, how much they've thought about this. And I'm starting a TAFE course here, I'm going to university here, I want to do this particular thing. It's really inspiring. And yeah, we've got a whole community of very valuable adults contributing to community all over the place. It's so exciting. Yeah,
I think it's a really beautiful thing, because that concept of kind of holistic care, where when you come into a hospital, yes, it is about a condition, but it's actually you are a person and this is what you come with, and we see that as well. And do you think that's really valuable in, I suppose, the support that you provide is that holistic kind of pillar.
Completely. It's all about that. And it's all about not being stopped, really, and thinking big and dreaming big. And there may be things that I really want to do this. I want to travel. I want to go here, there. Yes, of course, travel. But we talk about that in the context of. And in my experience, it's never minimizing anything. It's actually maximizing it and thinking about possibilities everywhere. So I think travel is really a great thing to talk about. Independence and transport, friendship groups, we get real peeps in these conversations. You can get a real glimpse of how wonderful life is looking for this young person, and they're living into this idea that this is what they'd like to do in their lives. It's very exciting. So it's, in a way, the appointments are a little bit about celebrating that in the context of healthy practices, good physical activity, what do you do for physical activity, sleep hygiene, we chat about too, because that's really good. It's good for all of us. And in nutritious diet and that. And we talk about sexual health. We talk about the influence of drugs and alcohol and vaping, and chat about those things in that really warm and confidential space, so questions can be asked.
Oh, I love that. When I was growing up, this was a very different experience, I think. And I think I have this way of thinking about my health that sits very separately to the rest of my life. And it's taken me a long time and still working on that. And I think people, CAHD and COHD people of my age and older will very much feel that this is what I do over here when I look after my health, but then I'll go and do the rest of my life. And I'm meeting more and more young people who have the holistic model, who have integrated so much of who they are and their identity around their heart into their life. And I think being somebody who fosters that independence and really encourages that in young people, like, what is the advice that you would give them about caring for themselves and balancing their medical needs, but also becoming independent and being able to carry both of those things at the same time?
Yeah. I think there is that everything in your life is I suppose there's moderation in everything. It's all part and parcel of it. If you push the boundaries in one area, you're doing that knowingly, just to pull back in again and take good care of yourself. So a real focus on that self-care, but also that self-compassion as well, and being really kind to yourself and really valuing yourself. So I think very good emotional and social support, along with good knowledge and information about your health condition, having questions to ask, and linking out, almost doing a mind map of who do I talk to about this, where do I go for this, and having a youth-friendly GP is something we really promote. Finding yourself a GP that sits with you, who is youth-friendly, is going to encourage you to do all your travels and do your things that you want to do in your life and have your adventures, and do that with knowledge and with good information. Do that as well informed as possible. Yeah. 100%. I don't know if I've answered the question well, Rachel.
No, that was perfect. And I really like the youth-centered GP, because I think finding a good GP is a big one.
Huge. Yeah.
I can't count how many times I've told somebody that I have tricuspid atresia and I've watched them Google it. So it's a bit difficult sometimes.
Yeah.
But when you find one, you hold on to them.
Yes. And they help to normalize things too, I think, because they don't see you with tricuspid atresia. They see you as Rachel, who's having this amazing life. And I think that's what we want our young people to experience.
100%. And then I suppose in terms of thinking collaboratively, obviously the independent aspect of living life with a condition, but stepping back in terms of the support system and the collaboration that exists. I suppose, who are the factors in managing health, and how do they work together when it comes to navigating a transition period?
So just who are the people?
Yeah,
I think it's really important. Like, when we first talk about the transition process, we have contact numbers to call with any questions, and we provide information. So I think that kind of to have a form of contact and someone to ask questions is really important. I think going back to the cardiologist, very important, but the GP, good healthcare, access to good healthcare. I think connecting with others is really important, other like-minded people, but other people living with COHD as well is really helpful. So if there's an opportunity to go on a teens camp or like some sort of an event that brings young people with COHD together, I think that's amazingly empowering as well. And I think one of the examples of that is Heart Kids Teens Camp, for instance. Everybody makes a friend. It's fantastic. But the volunteers themselves are these really inspiring adults doing amazing things in their lives who come back to contribute to teenagers and help them connect and feel empowered in themselves and their bodies and their lives. I think having good friendship groups and having friends that you can talk to about, that young people can talk to about their heart condition as well as everything else,
100%. You've had a lot of children that you've seen transition, and I'm interested, what are the changes that you see in that process, and what are the attributes, things that children begin to gain that are aligned with a good experience?
I think it's just amazing. I find them very inspiring. I find it all very inspiring. I think they find themselves and their heart condition and their own dreams and aspirations.
I love that. And I do want to ask as well, because I know that often a lot of the people that we talk to do have to travel for their healthcare. And that is often really difficult and does put a strain on families. And I suppose there are some instances where people are receiving care from a regional or a remote or rural hospital that might not have the level of transitional program that a major hospital might have in a metropolitan area. What are the steps that people who are living that experience can take to help aid a transition process? And what are the ways that families can prepare if there is a formal process in place?
I think that's a really important question, and we do, certainly in Western Australia and anywhere in a big country like Australia, that's the story of our country, isn't it? And we have quite a few telehealth appointments for our young people, and we really encourage them for their transition appointment to actually come into a health facility close to their home. So it is telehealth. It's not just on the Wi-Fi at home in the living room with everyone else in the family maybe walking around in the background, that it can be actually a really nice, proper, confidential transition appointment. And we can do that again and again. Like as nurses, we can catch up. We can offer more than one appointment indeed, but the transition clinic appointment, the one by the doctor for transition, is where the referral is done, any other tests are ordered, and there's a really good conversation about the psychosocial issues that I've talked about in preparation. But then I think we can provide so much more with our communications, with our telehealth, and it's identifying again other champions in that area, again really promoting that access to good primary health, GP, dental, those sorts of ancillary and support health, and even life coaching and that sort of thing, just support, peer support, that sort of thing when you're isolated, geographically, that is.
For people who are really interested in what you've been talking about or getting ideas or want some support, where can we find more information? Where can we find more support?
Yeah, so the Standards is a public document that it's so fantastic. So Standard 5 is dedicated to transition care. And I would always direct people, and we share a lot of our resources, and we share them with Heart Kids. There's a huge amount of resources for teenagers, but for young adults and for adults, older adults living with childhood-onset heart disease. Yeah, so the resources definitely, but most importantly, connecting with others, connecting with others and having that. There's a group of young adults now that get together here in Western Australia on a, bi-monthly basis and have dinner together, so, and that's kind of come out of people who've volunteered through the Heart Kids camp, but it's kind of, you can see that momentum is going to just broaden and get larger and bigger. It's powerful.
Look, I could pick your brain all day, and I imagine you would just give me a wealth of knowledge that we could talk for hours, but I always feel cruel asking someone with such expertise to sum it up so simply. But I guess if you had one take-home message that you wanted to share with heart kids, young people and parents about transition, what would it be?
I would say transition is something that we'll take our time with. We'll move at our own pace, your own pace, the young person's own pace. It is about looking to the future in a positive way. It's almost a celebration. And one of the things that I do say is we might have done the referral, you might have had transition appointment, you may not be expecting to see the doctor for a few years, but we keep the young people on our books, with a kind of a chart-only appointment, we call it, but it just means that they're not going to fall off our system until they've had that first appointment. So it's that sort of making sure that from our perspective that we close the loop appropriately, because there is that risk of, getting lost to follow up in that time. We don't want them to fall off. So I would say very positively, it's something to be celebrated, and lots of reassurance to parents too, because I think at that time of transition, in my experience anyway, the teenagers are pretty chilled out, but the folks are pretty anxious. Yeah.
Very much so. I think my mum always said we should have got you a birthday cake or something, because it's like you've just turned 18 early.
Well, I like that very much. I think she's absolutely right. It is a celebration, and really being able to reflect back to these beautiful teenagers, all the amazing qualities they have, and that they're in very good stead.
Mary, thank you so much for your time. It's been so wonderful to be able to talk to you and pick your brain. And I think transition is such a daunting experience, but to have learned so much and to know that there's so much care and love in that space is very reassuring. So thank you.
Thank you. It's lovely to meet you, Rachel. Thank you so much for having me.
This podcast deals with some heavy things. If this brings up anything for you or somebody that you love, it's important to reach out for help. The Heart Kids Helpline provides support, advice and guidance for people impacted by childhood heart disease. You can call the helpline on 1800 432 785. To access more information about childhood heart disease as well as support from Heart Kids, visit the website heartkids.org.au. The information on this podcast is not a substitute for medical advice from your doctor or healthcare team. Always talk to your doctor about matters that affect your health or your family's health.